quick start. I think so far how the session's going. So are you able to understand the unit safeguarding that we're discussing?
Yes.
Okay. And in terms of, some of the additional reading which I mentioned towards the end of the slides, are you able to go and read those as well? Because that will give you some additional information on, the topic of safeguarding.
I haven't, but I will.
All right. Okay. Good stuff. So today what we are looking at doing is basically starting Learning Outcome 3. And Learning Outcome 3 is focused around, understanding what is the policy from a, context of safeguarding. What is government's policy on safeguarding? How do we look at national policy on safeguarding? In general, what we want to understand is that what is the context of why safeguarding as a topic or as a main area of discussion came up. So we will look at some of this in terms of understanding the context of policy and policy making, from for the purposes of safeguarding, and what is the role of, say, national government, what is the policy, from a government perspective, and how do we look at, looking at basically understanding the legislation, the key aspect of, let's say, the policy guidelines from the government on the topic of safeguarding. So here, safeguarding is, as I mentioned, just do a quick recap. So what is safeguarding? Safeguarding, if we look at, safeguarding is essentially the act through which we are trying to protect children, vulnerable adults, or, people who have disabilities, primarily from three different aspects: harm, which could be done from the aspect of abuse, exploitation, or neglect. And this is an essential part of, implementing safeguarding within organization or within a setup, is because what we want to be able to do is ensure that people are able to get access to health and social care, and health and social care services. And, they are able to get it without any aspect of being neglected, exploited, or harmed or abused in this, context. So the policy side of safeguarding essentially refers to, the multifaceted aspect of legal, ethical, and professional standards which are set in place to be able to ensure that this is able to then help when we implement this concept and the context of safeguarding. Then members of public are able to access the health and social care services, mental health care services, clinical services, without being harmed, abused, or neglected or exploited within the UK. Now, what is the statement of policy on safeguarding? Policy on safeguarding is a statement which basically is let's say, a declaration made by the government to say that every organization which is involved in the delivery of health and social care services, any type of health and social care services, whether it's care, mental health care, clinical services, children's services, is going to be able to, adhere to these guidelines which have been set. And the government wants an assurance that the organization which is delivering these services has a commitment and a sign-off in terms of implementing this policy within the setup of the organization. Now, when we talk about, the context of safeguarding, what we are looking at is the basic definition that when we look at the legal aspect of it, the ethical aspect of it, and the professional context in terms of standards part of it, we are adhering to ensuring that all these three, in the case of legal context, when we look at legislation like Care Act, Mental Capacity Act, we look at Human Rights Act, we look at Equality Act, Child Care Act, all these are adhered to when we deliver these services. From an ethical perspective and context, what we will say is that the safeguarding involves ethical considerations, which could be, promoting things like the 6 C's. Out of that, some of them like dignity, respect, independence. And then we are looking at the ethical principles, which basically uphold the individual's rights and responsibilities and the values. and we are able to then provide these services to young people, mature adults, vulnerable adults, or people with disability while they receive care in our jurisdiction within the organization or within a particular setup. And an example of safeguarding policy is something that you will see on our website as well. So there are safeguarding policies and principles which most organizations have to adhere to teaching and learning, colleges, universities, hospitals, care homes, various organizations, businesses have to have a safeguarding policy. And the policy here is to look at maybe an implementation of the policy here is to look at that if you're recruiting right people to work and volunteer and work with children or vulnerable adults or young, people in general, they need to be able to understand the context of safeguarding, preventing bullying, preventing harm, preventing abuse, preventing, abuse by neglect, or in some cases, even spotting exploitation. And they should be clearly able to understand that this is something from a policy perspective important because it is essential in promoting the protection of vulnerable individuals and ensuring that practitioners, when we talk about practitioners, we talked about practitioners yesterday, talking about, healthcare workers, health visitors, nurses, and then we talk about practitioners like doctors and, occupational therapists and, administrators. They are working legally, ethically, and with professional standards to be able to ensure that the delivery of health and social care services are provided in a safe and, meaningful manner to the members of public. Now, when we talk about, say, what is safeguarding policy in the UK? So safeguarding policy in the UK is protecting the right of adults to live in safety, free from abuse, neglect, or exploitation. And people and organizations have to work together to be able to prevent any risks which can happen in promoting safeguarding or, in promoting or delivering these services to members of public or individuals who are young people, you are vulnerable, or you're, adults which are receiving these services of care because they are disabled or they have vulnerabilities. Now, there's a clear adaptation of this safeguarding policy, which has been done by Ofsted. And what I've done is I've left the link on the slide because here, when we look at the Care Act of 2014 in particular, the safeguarding policy, which basically was introduced and it became a part of Ofsted, inspection framework, clearly is highlighted in this slide. So when we look at Ofsted's safeguarding policy, we are looking at, protecting the rights of the adults to live, obviously, in safe and, safe and free environment. When I say free environment, it is free from abuse, neglect, harm, or exploitation. We also want to look at that when we look at this concept of, Ofsted's policy of safeguarding, there is a link which I would want to show you, which is on the website. And this particular link that, basically explains the policy, government's policy in a great amount of detail, and something that is expected that if you draw funding, if you say, for example, provide any sort of services, then it is a mandatory requirement from the government department with organizations receiving funding and delivering these services directly to the members of public to be able to implement the safeguarding policy within the organization. So there's a clear document and policy which has been described, and some part of this, which I look at in the context, I've taken into the slide to say that when we look at going to nurseries, when we go to schools, when we go to colleges, universities, or community treatment centers, we go to places which are say, for example, childminders or people who are dealing with looking after children in foster care. They will all have the statutory requirement of implementing the safeguarding policy in that place. And this would mean that various agencies would need to work together in order to ensure that this is protected and this is provided as per the guidelines which are, as per the guidelines which are given by Ofsted in their policy. So this could be, say, some part of additional reading if you want to look at, but maybe parts of it which are extracted. There is a strategy document given here, which is underpinned that when we look at the core principles of safeguarding, it is going to look at safeguarding children and students first. It is going to look at promoting independence and autonomy, and then it is going to be relating to accountability and transparency. So transparency being that every organization is inspected, and obviously they are looking at the standards in which how they are implementing these policies in the organization. And Ofsted has a grading scale of below average or say not meeting the criteria, average, outstanding, and above, or excellent, or good. The 4-point criteria, which basically looks at inspection framework. And that is important because these organizations would need to maintain and implement these policies, the safeguarding policy or the adaptation of the Ofsted safeguarding policy within their organization. So going back to this slide, what we want to look at is, let's look at a video which basically talks about the context of safeguarding, and it relates it to the policy which the government has put in place from a point of view of how safeguarding and safeguarding principles are important in the aspect of promoting them within any organization. So let me just play this video. A short video that we want to watch.
Contextual safeguarding is an approach to safeguarding children and young people that recognizes and responds to their experiences of significant harm beyond the boundaries of their home. Contextual safeguarding approaches require practitioners to identify and respond to risks and vulnerabilities facing young people in a range of social environments. In other words, the contextual approach to safeguarding identifies and responds to more than individual risk factors and vulnerabilities. Child protection and safeguarding structures already routinely identify and respond to violence and abuse experienced by young people within their family or home settings. However, these structures are yet to consistently engage with other social environments where young people spend their time. As young people enter adolescence, they spend increasing amounts of time outside of the home and may experience violence and abuse within these public environments. We know that a young person's peer group can be more influential than their family when it comes to setting standards of what is normal, and we know that peer-on-peer abuse can affect any young person. While schools can be a protective factor for many young people, research has also documented young people's experience of sexual harassment and other forms of peer-on-peer abuse in educational settings. Schools have also been sites of peer recruitment into abusive and sometimes organized networks of exploitation. We know that young people experience violence and abuse in public spaces. Exposure to violence on the streets has been routinely linked to a young person's involvement in street gangs, and young people have been sexually exploited in parks, transport hubs, shopping centers, and other public spaces. Contextual safeguarding calls for a safeguarding system that assesses risk and intervenes to protect young people beyond the boundaries of their home. For more information and resources, please visit the website of the Contextual Safeguarding Network.
So you look at, in terms of, when we talk about contextual safeguarding, what we are basically looking at is talking in the context of how safeguarding is being implemented within different organizations. So is that difference understood in terms of when we say contextual safeguarding? So basically the video highlights, what does the video highlight? What does the video talk about? The video actually talks about, how this approach of safeguarding acknowledges the importance of wider social and environmental, contexts in which children and young people grow up. So it recognizes, how young people in general may experience harm and abuse outside their homes. And the video talked about, various places where the abuse, harm, or neglect or exploitation can happen. So it could happen in, different, we consider them as traditional places, but there could be harm which could be done to the individuals in these traditional places as well. So when we talk about contextual safeguarding, what we are looking at is identifying and responding to risks of harm that can actually arise within the young person's wider social and environmental context, things like schools, neighborhoods, online, spaces in terms of chat rooms and things like that. So that is what the video also alluded to. And it also aims to understand how we address this wider system and structures so that we put this in place so that they can contribute to, eliminate harm which can be done through gang culture, racism, or online exploitation. So this is an important aspect because now, as you can see, that a lot of context of how people can be influenced is happening online. So contextual safeguarding is looking at some of the non-traditional mediums through which harm can still be, imposed onto young children, young people, or even vulnerable adults, and they tend to be, done through the traditional channels or non-traditional channels that we look at this way, that they could be online. It could be racism and, exploitation, which they are facing online. So there has to be a wider range in terms of approach when we look at, how safeguarding can be implemented within different setups, traditional, non-traditional. And this could be done using, professionals, agencies, social workers, teachers, police, healthcare professionals, youth workers, and they all have to work in a collaborated multi-agency approach which seeks to build partnerships and networks to protect vulnerable young people. So contextual safeguarding is becoming important because it is empowering young people and also involving them in the decision-making processes that can affect their lives. So this is an important adaptation to safeguarding policy because contextual safeguarding is an innovative approach which is seeking to address limitations which are there in traditional safeguarding approaches. Which I would say was initially proposed when safeguarding, came out in 2014 or under the Health and Social Care Act, or under the Healthcare Act of 2014, safeguarding as an approach was established. So contextual safeguarding is now taking it beyond the traditional methods and is basically an innovative approach that seeks to address limitations which were initially addressed in traditional safeguarding approaches when it was brought out in 2014. And this contextual safeguarding, approach provides more effective protection to young children in changing, let's say the complex landscape, which is social media, online grooming, looking at terrorism, looking at influencers on YouTube, Instagram, gang culture, we look at racism. These kind of things are typically things which you are getting to see, which are being addressed, in currently the contextual safeguarding approach. Now, one of the other videos we want to very briefly look at, which gives us a perspective of why is safeguarding important, in the context of healthcare. This is something that we also want to understand, is that why is safeguarding important in the context of healthcare? And when we look at safeguarding practices in general, what you're going to be able to see is that there are various ways in which this approach is currently being put forward by various practitioners. And this approach is now becoming important in terms of ensuring that it is available and it is implementable within the setups when we talk about providing care to individuals. So this is again a short video which gives us some of the good practices which need to be followed when we look at the process of safeguarding, within health and social care. So let's listen into some of these, case examples when we talk about good safeguarding practices in health and social care and why it is important?
Safeguarding children is often referred to as a jigsaw puzzle, whereby little bits of information have to be put together to try and create a picture of what life is like for a particular child, and then decisions can be made about what intervention is needed. So within any primary care practice, it may be any member of staff that has some really important bits of information, important pieces of the puzzle. So for example, it may
be your receptionist that's observed a particular interaction between a child and a parent out in the waiting room. It might be your dispenser that's got some really important information about a parent who's not connected a prescription for their child. Or it may be one of the GP partners who holds some really important information about a parent's mental health condition, which means that it might be very difficult for them to safely parent their child. And each of those pieces of information has got to be put together within the practice to try and understand what's going on. Because we know that in safeguarding, we make decisions based on the information we have available. So if we have poor information, we make poor decisions, and ultimately that results in poor outcomes for children and families.
As the eyes and ears of the practice, we are well placed to identify the most vulnerable patients. For example, when an elderly patient who has dementia comes in and is quite confused and has turned up for their appointment on the wrong day, we can make sure that their GP is aware. Another example is allowing a homeless person to register at our surgery even if they don't have any ID. This allows them to still have access to healthcare.
One of the ways we proactively look after our vulnerable patients is by prioritising our children who are on the child protection plans or who are looked after children. Our admin teams ensure that their notes are appropriately flagged so that when those children or families contact the surgery, we can prioritise their needs.
The most effective tool that we have in safeguarding is communication. Good communication is really vital to safeguard effectively. Communication is particularly important with our patients, their families, their carers and their advocates. It's also really important that we have good communication within the primary care team and with our wider healthcare teams such as school nurses, midwives, learning disability teams, mental health teams and secondary care.
I liaise closely with community pharmacists, hospital pharmacists and the team at the spa surgery to ensure our vulnerable patients have the correct medication and that they receive it when they need it. For example, those with learning difficulties and severe mental health problems. I spend a lot of time with vulnerable patients, the families and the carers, enabling them to understand the medication and how to take it effectively.
The practice endeavours to attend most child protection and adult safeguarding conferences for our patients. We recognise that these are some of our most vulnerable patients, and being involved with these conferences, we can proactively support them with their health needs. It also enables us to work with other agencies for the best outcomes for this group of patients. The whole team are involved in enabling a GP to attend a safeguarding conference. So from the practice manager who supports the GP attendance, the team who manage the rota, the secretarial team who send the reports in prior to the conference, and the coding and summarising staff who ensure the reports from the conferences are accurately recorded and processed.
By thoroughly and systematically summarising new patient records, we're able to identify new patients and families who may be vulnerable and require additional support. We're then able to alert the GPs to these families. For example, through summarising a new patient record, I identified that there was a history of domestic abuse in a household where there was also a young adult with learning difficulties. I was then able to alert Joy, our practice safeguarding lead, to this, who was then able to bring the family in to see her.
Because it's very clear on our patient records when there are safeguarding concerns or that a patient may be vulnerable, I am able to offer the patient additional proactive support and also raise any concerns with their usual GP. In this way we can all work together and as a team we can safeguard our patients.
Well, I think we're in a really privileged position in the primary care services with access to the most sensitive information about people's lives. So just like everyone in the NHS and the public sector in general, we have a duty to protect the people that we serve. Patients should be safe in the knowledge that when they walk into our surgery, they're welcomed and looked after to the best of our ability, no matter what their personal circumstances. We should not see the duties that we have to safeguard adults as extra work or somebody else's problems. We're responsible professionals and we will do whatever we can to help improve people's lives when they're at their lowest point, and that's what I call doing a good job.
As you can see in this video, it talks about various perspectives of nurse, healthcare assistant, pharmacist. You look at health and social care worker, somebody who works at the reception, all of them giving their perspective in terms of how they would work and spot, and obviously look at providing services, to various individuals, and then alert various authorities if required, if they feel any sort of exploitation, abuse, harm, or neglect being done, to the patient. So when we talk about, in general about the importance of, safeguarding, in particular importance of safeguarding in, health and social care sector, what we are looking at is we are basically looking at maintaining, the aspect of ensuring that the health and social care services are being provided to vulnerable individuals without they worrying about that they are going to be put in the harm's way, or they are going to be abused, or they are going to be exploited. And one of the clear aspects of safeguarding as a policy and its implementation in the health and social care sector is that all professionals, when I say professional, I can also say all practitioners, are required to undergo training. And they are required to undergo safeguarding training to ensure that they are able to care for their patients and clients and are able to provide the care in a safe and well-protected way, which is taking them away from any harm, abuse, or neglect. And this is one of the key criteria that is required for them to understand when they undergo safeguarding training. And in order to put this into context, some of the other bits that, practitioners have to look at is to understand the importance of why safeguarding has been brought into, health and social care in essentially in the first instance, is because what we have seen over the years, and when this policy wasn't there, and we played a video yesterday wherein the doctor or the, consultant spoke about his experience of, working with the Blackpool Trust. In that video yesterday, when we looked at, he said at that point in time, when he had raised the alarm through whistleblowing, there was nothing like this policy which ever existed. So his main aim of raising alarm in the organization was to prevent harm being done to the patient. He wanted to look at, in general, overall promoting well-being. And he also wanted to ensure that there is some sort of a legal compliance or a route available with the patient who was being exploited, or, in this case, not being provided proper services, which was putting the health and safety of that patient into serious risk or danger. And when we look at now the implementation of policy of safeguarding within organizations, what we see is that this allows the element of trust to be built, and it also looks at improving outcomes which are effectively being delivered by the implementation of safeguarding policy and measures within a particular setup or within a particular health and social care setup. And this is, for example, to say that if you are trained on the process of understanding what is safeguarding and how to spot the signs of abuse, neglect, exploitation, or harm, then you are able to clearly identify and respond to the signs of abuse and the neglect which is happening. And this then can be averted to relevant authorities, maybe your manager, local authority, or maybe your senior supervisors, so that it can help in the improvement of some of the delivery of these services which are being done to the members of public. These services could be health and social care services, physical and mental health care services. It could be services being delivered to vulnerable adults, young people, and all this is contributing to the overall well-being of the individual receiving the services in the correct fashion and correct manner. So safeguarding is an essential part or aspect of health and social care services because it helps to protect people who are vulnerable, or individuals or people, whichever way you put it, are vulnerable to harm. And this implementation of this policy ensures that they receive care and support that they need in the way they need, which is personalized care and support, so that they are able to thrive or get well soon or get back on their feet as soon as possible. So that is why the concept of safeguarding is very important in the context of health and social care. So this is a bit of a brief understanding, an overview of the learning outcome, which is what we are studying today, in terms of what is the context of safeguarding in the context of, say, policy in the UK in particular, and then the evolution of the context of safeguarding policy when it was introduced in 2014 to what is it evolved today to what is called contextual safeguarding, because there are ways in which individuals can be exploited through the non-traditional route, which were considered traditional routes earlier, but there are lots of new routes which have come up, things like online abuse, gang culture, racism, online exploitation, and that is where the concept of safeguarding is now evolving to what is called contextual safeguarding. And then we looked at the various aspects of why safeguarding is important and how it is delivered through various different setups within the health and social care sector. So we looked at a video of a GP surgery, and obviously various viewpoints of members of staff actually working in the GP surgery to be able to provide services to the members of public. Now we are going to go into some of the assessment criteria of this learning outcome, and these assessment criteria, there are two that we need to look at today. One is we are looking at clearly identifying the legislation and policy guidelines related to safeguarding. So what are the key acts which are important for us to understand, and they at some stage are related to the process of safeguarding, or were essentially, when put into practice, also look at ensuring that safeguarding is being done when services are being provided to young people or vulnerable people or children or vulnerable adults. So these acts which are put together on the table is something that we need to go through. So there is the Children's Care Act, Children's Act of 89. There's a Children's Act of 2004. There is Care Act, Mental Health Capacity Act, Human Rights Act, Safeguarding Vulnerable Groups Act, and Information Sharing Advice for Practitioners Act of 2018. So these are acts that you need to be aware of, which will be working in tandem with safeguarding policies, and they are a minimum requirement from UK's perspective or UK government's perspective, and in terms of law and legislation which are to be implemented in places wherein public health services are being provided to the members of public. I won't go into details of these acts. So what I've done is I've done a table which allows you to go through the summary statements of some of these acts to understand why they are related to safeguarding. Now, we also want to look at some of the primary legislation that have been put in place over the years. And these primary legislation that have been put into over the years are also related to safeguarding. So when we look at the Equalities Act of 2010, we look at the Human Rights Acts of 1998, the Care Act, which clearly looked at establishing SABs. We discussed SABs yesterday. And then the Health and Social Care Act, wherein this established the health and well-being boards and the CCG groups. So when we talk about the CCG groups, the clinical commissioning groups, they are being disbanded now, and a new organization or a new setup is being created, which is the health and well-being boards. These particular organizations are basically responsible for planning, designing, and commissioning healthcare services in a particular area. So they work very closely with local councils, authorities, and policymakers to be able to provide these services to the members of public. So when we talk about the HWBs, the health and well-being boards, and the CCGs, they are very important because they are responsible primarily in England and Wales to be able to assign roles and responsibilities, and also they are responsible for designing, planning, and commissioning healthcare services for the local populations. So these are some of the acts and primary legislations that you need to be aware of when we look at addressing this particular criteria, which is identify the legislation, policy, and guidelines related to safeguarding. Now, what is the national policies that also play a crucial role in, obviously safeguarding vulnerable adults? So there are policies at that, in terms of national level as well. So one is the Mental Capacity Act, which basically is of 2005. There is a Deprivation of Liberty Safeguards, DOLS as we call it, which is a further amendment to which provided further amendment to the Mental Capacity Act. And, this is something which is specifically related to vulnerable adults. Now, we look at some professional bodies, which are professional bodies for nurses, doctors and social care workers. Do you know of professional bodies, for doctors? What is a professional body for doctors? Any idea? What are these professional bodies? Any idea? So in the UK, when we talk about the professional bodies for doctors,
Excuse me, is it like the consultants? Those top doctors, like the consultants. We have student doctors, we have
So there are 17 or 18 professional bodies in the UK, but when we look at specifically for doctors, we talk about the GMC, which is the General Medical Council. Now, this is responsible for maintaining standards in medical education practices for doctors in the UK. When we talk about nurses, we talk about the Nursing and Midwifery Council, which is the NMC. The NMC is responsible for regulating and maintaining the standards of nursing and midwifery and practices in the UK. When we talk about care workers, there is a body called HCPC, which is Health and Care Professionals Council. And this particular body is responsible for regulating and maintaining standards and practices for a range of health and social care professions, which include social workers, healthcare visitors, occupational therapists, physiotherapists, paramedics, and that body is HCPC. Now, these bodies also have within them, in terms of their constitution and within their remit, to be looking at promoting safeguarding practices, which would then help look at providing services to the member of public without any harm, neglect, exploitation, or abuse. There are lots of other bodies. There is a body for dentists, there's a body for opticians, there's a pharmaceutical body, which is General Pharmaceutical Council, GHPC. You have General Optical Council, GOC. You have General Dental Council, which is GDC. There are lots of bodies. There are 17, 18 bodies. But when the Safeguarding Act was introduced, a lot of these professional bodies are also responsible for endorsing, the standards which are required to maintain and provide safeguards to vulnerable adults, young people, and children. So they also very closely have an adaptation of the safeguarding policy and the act as per the government guidelines, and this is a part and parcel of their, professional membership as well. And then we look at regulatory bodies like CQC. They are government agencies which basically have the duty to regulate, inspect, and rate all providers of care. Now, this particular body is responsible for inspections, is responsible for grading the inspections, and if they find any slippages of standards happening or policies not being implemented, compliances not being met, legislations not being followed, can sanction, can revoke, and even install or take criminal action against the management or the key members involved in working within that organization. So these bodies are bodies which basically influence policy and development of policy at the national level when it comes to safeguarding. So obviously they give advisory to the government, and when changes happen within policies, they are also then looking at making subtle changes to their policies and procedures to ensure that safeguarding requirements are essentially incorporated within the adaptation of their policy and guidelines as well. Now, there are lots of local systems. When we call local systems, we talk about them as local authorities, or essentially what we say councils. Now, there are some areas in England and Wales which have devolved, powers. So when you look at Leeds, when you look at Manchester, you look at Liverpool, you look at London, or Birmingham, there the policies, national policies are adapted by the local councils. And there, the implementation of the national policies and objectives is done through the, contextualizing of these policies at the local level. So here, their role is to look at ensuring that they meet the national standards which are set by the government and parliament and in the legislation, and they adapt them to be able to deliver them to a particular location or in a particular town or city. And then we talked about safeguarding adult boards, which are basically, a combination of what is called the multi-agency teams. Now, these are boards which are formed up of the representation from local police, local authority, the central, the side of the government, and obviously also looking at, providers, care providers who are providing this particular care to members of public. So these boards essentially were set up as multi-agency partnerships under the Care Act of 2014, and they work together with local partners across the city or say a town, and they include representatives from health and social care. They include representatives from police, from the local housing council, and also other relevant agencies which will work together and prevent and report any incidents which are happening because of neglect, harm, exploitation, or abuse within the area. And their key functions tend to be looking at ensuring that the national policies are adapted and then implemented in such a way that it helps protect, vulnerable adults and young people and safeguards them against any risks in the area. That means if they're living in a particular place like council housing, then they are not at risk to, being abused or harmed in any way possible. They will also look at ensuring that the policies are reviewed and also reviewed regularly. You can't just have a policy that is made once and then not reviewed. So these policies and implementation of these policies are reviewed once a year or once in 3 years to ensure that they are current and they are suitable for the local population and the place where they are being implemented. They are also responsible for coordinating and monitoring the effectiveness and the implementation of this policy. They want to ensure that the practices are even all across. It can't be that we put a safeguarding policy in place, but we don't have a safeguarding, officer. We don't have a whistleblowing policy. So they ensure that every organization which implements is actually, meeting the basic minimum standard described in the policy. And their main aim is to basically ensure that there is no abuse or neglect or exploitation or harm, being caused to anybody in the local population. And they are mandated to provide any sort of support from the local government they need in order to make sure that this neglect or harm is being avoided. So they will have members, which will come from different setups, things like the police, health and social care services, housing, and local council and things like that. And they will then be forming up this safeguarding adult board to ensure that in a particular town or a city, the policy is implemented, the legislation is met, all organizations which offer such services are adhering to the policy and guidelines set by the government, and there is no abuse or neglect or harm or exploitation happening. And if it is happening, they need to report, investigate, and bring the perpetrators to, justice. So the bits that we want to understand in terms of assessment criteria 3.1 is that we should know what is the legislation, which is the legislation or, policy introduced as an act by the government. We need to know what is the policy. Legislation, when it is introduced in the parliament, is an act. And that act then is translated into a policy document, which is then implementable within an organization or a setup. And then the policy provides the guidelines, which are basically, which have to be followed in order to implement the process of safeguarding within a particular place. So in this context of the assessment criteria, we need to clearly understand what is legislation, which is the act. What does the act then deliver, which delivers a safeguarding policy? And then the policy, what does it deliver? It delivers the guidelines or the process through which safeguarding is offered and is maintained and implemented within a particular setup. So in these slides, what I've done is I first started off with the acts or legislation. Then I've explained a few more legislations which are related to, safeguarding. Then we have gone into policies, which are going to be used to provide and safeguard individuals, and then look at implementation of these policies in terms of guidelines, which are done by SABs, local authorities, and the local constabulary, which basically put these into practice. And that is where how safeguarding is then, provided to members of public in a local area or in a local population. Is that understood? Yeah, any questions on this? So legislation is nothing but act introduced by the parliament or the government that leads to the creation of, an act, which is like the Equalities Act, the Safeguarding Act, the Care Act. The act then is used by the authorities, local authority, council, constabulary, SABs, CCGs, various groups to create policy. And policy is then translated into guidelines, which are then implemented to promote or the concept of safeguarding. This is how, you're going to see, the interpretation of the slides. Is that okay? Right. So let's go to the second assessment criteria, which is talking about evaluating the impact of key requirements of safeguarding. Now, what does the word evaluate mean, according to you? What do we need to do in this task? When I say evaluate, what is evaluation? Anybody in terms of what is the meaning of the word evaluate? So evaluate means we are looking at putting in arguments which are going to either support, for or against, and we're going to basically provide what are the arguments which are going to look at, making us understand the key requirements of, safeguarding. So evaluate tends to be, looking at basically providing arguments for and against to help us determine what is the significance of what is being discussed. So here the significance of what is being discussed is safeguarding. So what we want to be able to do is, in order to understand the significance of safeguarding, we will talk about the safeguarding principles. We'll talk about how safeguarding is delivered, how safeguarding is inspected or maintained, and what are the roles and responsibilities of various practitioners within this profession of health and social care, and what are their roles in terms of providing and meeting the safeguarding guidelines. So when we look at this, what we are looking at is bringing together the theory, looking at a bit of a practice, and then showing the application of it in terms of how this is being implemented within a particular setup. So here, when I talk about evaluate the impact of key requirements of safeguarding, what we are looking at is talking about the aspect of what are the key requirements that have to be met in order to ensure that we are a care home which has implemented, say for example, a care home which has implemented Safeguarding Act to the T. That means it has met the government guideline. It has a policy in place. The policy is fully implementable. There are guidelines in place, and there are clear defined roles and responsibilities of all the practitioners working within a care home. Things like a nurse, clinical nurse, maybe a receptionist, somebody who's an equipment operator, maybe a compliance manager. They all have very clearly defined roles and responsibilities in place. So when we look at various requirements, we are looking at requirements like one, for example, adherence to the Act. So here in this case, the Care Act of 2014, we are looking at putting in, once we put the Act together. So if I go into this particular bit here that I talk about, So what I would do is first I would start by talking about the Act, which is the Care Act of 2014. Then I would go into how the Act is being put to use by various agencies, which is they are working together to basically look at safeguarding children, or in this case, if I take an example of a care home, looking at safeguarding adults and what are the various things that they are putting in place. So first things first, training and development, which is to ensure that staff working within the setup is fully aware of their duty of care, and they are able to, stick to those duties and, obviously outperform those duties to the best of their ability. If there is multi-agency work, staff working within the setup like a care home, you have external people which come in. There are people who come in and work on locums, doctors, for example, nurses. They work in shift and shift patterns. Then you are ensuring that the multi-agency staff working within the care home is also aware of the safeguarding standards which are to be maintained by the care home. And in this case, you are going to be looking at doing relevant checks and putting in these checks through the process of undertaking what is called the data barring check, or DBS or CRB checks as we do. So if there's an external contractor or worker involved in terms of working within the care home, then DBS check has been done on his background to ensure that they have no convictions, and these the worker who's coming into work is going to be trained and is then able to work with adults, or in this case people who are living in the care home. Then they understand safeguarding policies and practices. So they have been adequately trained to understand what are the policies, what are the things they have to do, what are if they find neglect or exploitation happening, who do they raise the alarm to, what observation in terms of evidence will they do, what kind of, say, for example, evidence recording they will do, and how they will alert relevant authorities to be able to take action. Now, apart from this, when we look at, the process of how they would be looking at, say, for example, meeting the key requirements, they would be looking at promoting and working with transparency. They would be open to collaboration or working within teams. They would also be accountable, because when they are given a certain responsibility and they deliver it and complete it to the standard which is required, then they would be held accountable. If they are not meeting the required standards, obviously they will be put back into training. But even after training, if the standards are not being met, then obviously it can lead to termination of jobs in their services. And they would need to clearly understand how to improve and implement quality and quality policies within the care home. In this case, I'm taking an example of a care home or within the health and social care setup. And they are understanding their responsibility of their duty of care, that they need to execute and provide care with utmost safety, and also ensuring that the needs and rights of the individuals are, kept at the center of when delivering their, services. And if they still, let's put it this way, overall, when we look at the process of safeguarding, what we are looking at is that when they provide these services, they have a positive impact on protecting people and protecting them from harm's way, neglect or abuse or exploitation. And that is the central idea of, looking at some of the implementation of these key policies, the key legislation, I'll put it this way, the legislation or acts then translated into policies, and policies then translated into guidelines within the care home. And this particular process through which this is done within the care home will help in improving and providing these services which are required by people. And these services will be effective, they will be useful to the members of public, and they will also protect the individuals in the aspect of receiving these health and social care services within the care home setup. Is that okay? So any questions on today's discussion on the learning outcome 3? So only 2 assessment criteria to look at evaluating, and the other bit tends to be looking at the legislation side of things. I think one of the key criteria that you would need to look at is in a theoretical unit like this one, what we need to be able to do is understand the key meanings of the words. So as long as we understand the key meaning of the words or command verbs in the criteria, when we talk about assessment criteria here, that will be very useful for you to achieve higher grades. And if I put it this way, this is a handout which I will share today with you. And this handout should help you achieve higher grades in some of the graded units. So if I look at the word evaluate, and it talks about evaluate the impact of key requirements of safeguarding. Evaluate means you have to review the situation, bring it together to form a conclusion. And in terms of forming a conclusion, you have to give evidence for each of the views. That means advantages or disadvantages, pros and cons, and why you support a particular view has to be then backed up by these arguments. And that would be the meaning of evaluate. So this particular handout, which I'll share with you, basically would be giving you 3 pages. And sometimes when we look at assessment criteria or doing the task and assignments within various units, if you know the definition of the command verb, you know what the main keyword of the task is asking you to do. So if I take away the keyword, you sometimes cannot understand what the task is asking you to do. So if I go back to the presentation briefly and then say delete this word, evaluate. If I delete this word and it says now the impact of key requirements of safeguarding. So what do I need to do? I need to explain the impact, describe the impact, analyze the impact, evaluate the impact. You don't know what is. So I can write what is the impact if safeguarding requirements, policies are not followed. I can describe the impact that it will lead to abuse, harm, neglect, exploitation of young people or vulnerable or adults in a particular setup. But what do I need to do with that impact? So it does not tell you exactly what has to be done. If I go back onto the other task and I delete the word identify, it says the legislation, policy, and guideline relating to safeguarding. It becomes a very generic statement. I don't know what is to be done with this statement. So in order to look at assessment criteria, and when you look at doing assignments, there are key words which basically define what is the action or evidence and what is the action you need to take in order to compile the evidence. And that is why these words are called command verbs. So what I will share with you is this particular document today on email, and this will also be available to you on Moodle on the topmost section of the course, and this will clearly say command verbs. So when you have graded units, you have 3 different types of command verbs. You have pass command verbs, you have merit command verbs, and you have distinction command verbs. So these are the words that you need to be aware of in terms of definitions. So when you know the definition of the word, then you know how much to write, how much is too less, how much is too much to write. And that will allow you to do the tasks accurately as well. So I hope this has been useful. And if you have any questions, now is the best time to ask related to this particular outcome. If not, then we are going to catch up next week to discuss learning outcome 4 and also discuss the assignment brief subsequently on. So Saturday will be learning outcome 4 and Sunday will be the discussion on the assignment brief.
Sorry, Rama, the one you just showed now, is it for us to, when we want to do the assignment brief or?
Yes, so this is a document which is available on the Moodle. And what I would suggest is that you should look at this particular document, when you do the units specifically, which are graded, because the tasks which are set in the units allow you to understand how much you need to write, what you need to do in terms of justification, because some of the assessment criteria, when we look at the tasks which have been created on the basis of that, have specific meanings. And these words which define what is required to be done in the task are normally called action words or command verbs. So if you know the definition of the command verb, if I say apprise or if I say analyze, then you clearly know when I'm talking about analysis, then in that case, analysis would mean that you identify the factors which are responsible for it and then say how they are related and then you provide evidence to say how this analysis would be related to the task that you're doing. So for example, sometimes you have explain what is safeguarding. So explain basically means you are going to set out the meaning of the term safeguarding in detail. Then you are going to describe maybe what it means by giving an example. And that would be good enough. That is what explain means. But if I change that to describe what is safeguarding, or if I change that to say assess the safeguarding policy in your organization. So in this case, assessing would mean that one, I have to give a careful consideration to the policy in your organization. The word is policy in your organization. That means you need to get hold of that policy first. And then you have to read that policy by giving it careful consideration, because that's a policy for the organization. And then from that policy, you extract out what are the key factors which are required to apply safeguarding within the organization, which could be a care home, a nursery, whatever it is. And then you are going to summarize summarize how the organization is implementing safeguarding within the population in their organization. And that would be the meaning of the word assess. So assessment would mean you need to get something first, then assess it. So for example, if you want to buy a piece of cloth, you want to check whether it fits you or not. How would you assess it? You are going to basically either trial it out, or you're going to bring it home and then trial it out. When you try it out, you can then see whether it fits you or not fits you. And what you're doing is assessing. If I was saying, in a context, if I was using something else like, say, for example, demonstrate, then I would say, demonstrate would mean that you have to actually physically try it out to demonstrate that how it looks, and you have to give relevant examples. So similarly, the meanings of these words, when you look at this document, and if you know the meanings of these words, what do they mean in the context of the task that you do in the assignment, they are going to be very useful for you, because they will tell you, when you know the meaning, you know exactly what is required to be done. But if you don't know the meaning of the word, analyze, assess, compare, evaluate, explain, describe, define, then you are, just writing for the sake of writing, but not writing it to the point for which it'll help you accomplish or achieve that task. Right? So when we talk about analyze, you have to analyze means you have to look at theory, you have to look at giving an example, and then you have to make a conclusion that why this is okay. If I talk about evaluate, you have to give pros and cons, advantages, disadvantages, because you have to present the two sides of the coin. And then you have to agree to one side, that why am I taking this side, and then conclude. That would be evaluation. So these are important ways that you need to understand what is the definition of the command verbs. And when you know these definition of the command verbs, it helps you do your tasks more effectively, because you exactly know what is to be done.
All right.
Okay. No worries. Any other questions from anybody else? Any other questions?
No.
Okay, that's great. So we will end the session here, and then we'll meet up next week for the session with regards to covering learning outcome 4. And what I will do is I will drop these command verbs on the WhatsApp chat now, so that you are able to maybe save it and use it for especially the assignments which are graded units.
Okay.
Okay, thank you very much for attending, and have a good evening. I will see you next week.
Thank you.
Okay, thank you. Bye.